Welcome. This is Mental Illness Part 2 or Mental Health Part 2. These are the depressive disorders. You need to know mental illness, but you also need to know how to classify them. For example, the depressions are classified as depressive disorders. That is what they are called. Just like narcissism is classified as a personality disorder. Okay, so these are the three. Major depressive disorder is just normal depression. It's only 2 weeks. That's all the DSM says. That's the Book of Mental Disorders that doctors use to diagnose mental illness. It says only 2 weeks, which doesn't seem like enough time, but that's what the book says. 2 weeks of low motivation and mood. As So it's one thing to feel sad, like let's say your dog dies or something, but it's another thing to be consistently just want to lay on the couch and do nothing for months at a time. Um, we all get to a point where we're tired. I'm not talking about when you're tired. I'm talking about when you sit around and think I'm a worthless piece of garbage, and you can't seem to get up and go get a job or go get a boyfriend or anything. It's like nothing is worthwhile. And depression is the second most common mental illness in the world. Anxiety is number one. But yeah, depression isn't sadness, it's more like low motivation. Now, there is a mild depression, persistent depressive disorder. This is a depression where you can manage to go get a job, you can manage to live your life, but you still feel like you're not living life to the fullest. In my opinion, and I am not a doctor, but you could probably fight this with exercise, sunlight, dietary changes, and just listening to good music and having a positive outlook. I could be wrong, but when it's mild, you can fight mild depression with certain behaviors and thought processes. And then there's bipolar. Bi means two, bipolar, two poles. You've got mania, which is a time of high energy, happiness, motivation, fast speed of talking. And then you've got depression, which is just depression, laying on the couch, not doing anything. In order to see bipolar, there's a show on your Google Classroom called Modern Love, and it's episode 3. It's also on Amazon Prime. Really good. It's about a girl with bipolar. It's 34 minutes long. Okay, so nothing new, same thing. Major depressive disorder, low energy, low motivation for at least 2 weeks. Feelings of worthlessness, diminished interest and pleasure. You don't even want to do things that you know will make you feel better. Okay? Persistent depressive disorder, it's mild, it's persistent. And then, now this is not on the exam. Postpartum depression is depression you get after you've had a baby. A most famous case being Andrea Yates, who drowned her 5 kids in the bathtub. All 5 are her kids. That's serious. Most women don't get that serious of postpartum depression. Seasonal affective disorder. Without sunlight, people get depressed. There's a lot of that going on up in Seattle and Michigan and up in northern latitudes where it's cloudy a lot. How do you treat it? Get outside, get a convertible, get a light therapy lamp. Get on Amazon and look for a light therapy lamp. It does work. I have one. Okay. Bipolar. We're back to this again. Bi means two. Bipolar. You've got mania, and then you have depression. The College Board did list bipolar 1 and bipolar 2 as something that they want you to be familiar with. I wouldn't write it down, but I would definitely be slightly familiar with it. Bipolar 1, you've got plenty of depressing stages. And then you've got a much more serious manic stage than you do with bipolar 2. Bipolar 2 is not as severe as bipolar 1. The manic stage is so bad in bipolar 1, you might end up with the hospital because you might have that. It's almost going to seem like schizophrenia. It's going to be so bad with delusions, false beliefs, maybe even hearing voices. But you're not schizophrenic. You're just manic from being bipolar 1. This can end you up in the hospital. This can end you up in the hospital. So you need, if you are bipolar 1 or bipolar 2, you need to get that treated. Okay? Remember the PET scan? You've got a normal brain, May 17th. Then the next day, boom, manic. And then a week later, back to depression. So somebody with bipolar needs to get on meds. So remember, mania can be fun. You're energetic, but if it's too bad, you might have delusions of grandeur. I'm going to write a novel and I'm going to go to law school at the same time. And you feel like you can accomplish anything. You don't sleep as much. And when you wake up, you are the most productive individual you have ever known. You are like valedictorian type productivity. But then you crash. And then you can't get out of bed for 3 weeks or a month. That's bipolar. Okay. Hit pause if you want to look at this. Moving right along. Okay, just a meme. Okay, how do you treat bipolar disorder? There is a medicine. Well, it's not really a medicine. It's an element called lithium carbonate. Actually, it's not lithium, may be an element, but it's a compound. Lithium carbonate, a classic bipolar medication. Mood stabilizers is the more common name for bipolar medications, but this is on the list from the College Board. Okay. Lithium's been around for a while, and there are plenty of good mood stabilizers if you are bipolar. Okay. Now, I'm not talking about bipolar. I'm talking about just depression. What causes depression? Neurotransmitter imbalance, such as an imbalance of serotonin and an imbalance of glutamate. I've never heard of glutamate. I Googled it, and it turns out that it is a problem, and it's a part of the cause of bipolar disorders. I have never seen glutamate on the exam, but it might show up now. Also, irrational thinking can cause depression. If you tell yourself that if I don't get to go to this specific college, then life is not worth living, life is pointless. If your expectations are too high and those expectations are not met, then it's your thinking that's causing your depression. So that's an example of one approach to depression. This is a biological approach. This is a cognitive approach. All right. How do you treat depression? With talk therapy, cognitive behavioral therapy. Change your thoughts, change your behaviors. Or you could take a medicinal approach. You could take an antidepressant medication, like an SSRI. SSRI stands for selective serotonin reuptake inhibitor. I don't want to explain what that means right now, but know that the second S stands for serotonin. Prozac, Zoloft are examples of SSRIs. And there are other examples of SSRIs. All right, so answer this. The answer is major depression. All right, answer this. The answer is bipolar. Very talkative, overconfident, that's mania. Then feelings of hopelessness, that's depression. All right, which of the following is a common symptom of the manic phase of bipolar disorder? The answer is rapid speech. Okay. When you're depressed, you talk more slowly. All right, anxiety disorders. Generalized anxiety disorder is the most common mental illness in the world right now. Most of your mothers have it. It's when you have anxiety over nothing specific. I mean, if you have anxiety over something specific, like you have a job interview tomorrow, that's one thing. That's something specific. But if you have anxiety over everything or nothing, we call that generalized anxiety disorder. Panic disorder, think of that as a panic attack. Chest pains, racing heart, hyperventilating. I'm not trying to be funny. That's what they sound like when they get panic attacks. Phobias. And also social anxiety disorder, which is exactly what it sounds like. So let's go through these real quick. So first of all, anxiety is kind of like just worry and apprehension. Think of it as an overactive frontal lobe. Okay, think about like you just got too much going on. If you're in high school, you probably have anxiety. Okay, think of it as your brain has too many tabs open. You have too many things going on at once. That's anxiety. And it probably sounds very familiar to you. Now, generalized anxiety is when you have anxiety over everything or nothing specific. And the best way to deal with that is exercise, hot baths, uh, getting a good night's sleep, and maybe getting on anti-anxiety medication. Panic disorder, panic attacks, chest pains, hyperventilating, tears. I'm not trying to be funny, that's just what it sounds like. If you have a phobia and you are exposed to what you have a phobia of, then you might have a panic attack. Okay. This is new to me, ataque de nervios. This is a culture-bound panic disorder from the Caribbean islands. Now, if you know that in the Caribbean they speak Spanish, such as in Dominican Republic and Cuba and Puerto Rico, then remember that they speak Spanish there. And this looks to me like it's in Spanish. So basically, it says attack of the nerves or nervous system, nerve attack. Instead of panic attack, they call it a nervous attack. Same thing. But it's in the Caribbean only. So a culture-bound disorder, and there are two that you need to know. This is one of them. It's culture-bound. It only happens in the Caribbean and maybe southern Florida, okay, because of immigration. All right, moving right along. This is new in 2024. All right, phobias. There are way more phobias than you need to know. There are so many phobias, it's ridiculous. Okay? Just take a look at this. You don't need to memorize this, but know that when they say specific phobia, they're talking about you have a phobia towards something specific, like, say, spiders. Social phobia seems to be its own category. So let's talk about this. All right. I've never seen these on the test before, but they are on the list. Arachnophobia, fear of spiders. Acrophobia, think acrobat. Acrophobia is a fear of heights. Okay, moving right along. I have never seen this on the test, but they are on the list. They're probably not going to ask you to memorize it. They'll probably just throw it in an FRQ or something, or they'll just mention it. I've seen this once on the test, agoraphobia. It's basically it's a fear of being without your four walls. The four walls make you feel safe, so you don't want to leave the house. If you go check your mail, you might get a panic attack. Some people have agoraphobia. They don't want to leave their small town. Once they cross the city limits, their chest starts to hurt. Their breathing increases. They start getting chest pains and hyperventilation. So, I mean, it's different for everybody. For some, they don't even want to go out and check the mail. They just want to stay in their house. Social anxiety disorder, it's exactly what it sounds like. You get panic attacks when the thought of being around other people. The picture is fun, but it's not realistic, because if this person really had social anxiety disorder, they would be at home. They would not even show up to the party. Students with social anxiety disorder are generally homeschooled or are learning virtually. So how is this different than, say, avoidant personality disorder? If you have avoidant personality disorder, you're not getting panic attacks. You just are afraid of criticism. Okay? So this is an anxiety disorder. That means chest pains, hyperventilation. All right, moving right along. This isn't on the exam. That's just for fun. Okay. All right. This showed up this year. Never heard of it. This is new this year in 2024. Tajin Koyofusho. Culture-bound anxiety disorder experienced mainly by Japanese people, in which people fear others are judging their bodies as undesirable, offensive, or unpleasing. Okay? So again, it's an anxiety disorder that's combined a little bit with body image. That's all I've got on that. But it's Japanese. You could tell it's Japanese by looking at it, and it's a culture-bound disorder from Japan. Moving right along. All right, answer this. The answer is generalized anxiety disorder. So Jan isn't worried about anything specific. It's general. All right, answer this. The answer is, so she's in the Caribbean. What language do they speak? Spanish. The answer is ataque de nervios. If you said C, that's Japanese. Okay. All right, read that. The answer is panic attack, panic disorder. If you said B, psychotic means that they are hearing voices and having hallucinations. So no. Okay. There's a category called obsessive compulsive disorders. There are two that you need to know for the AP psychology exam: obsessive compulsive disorder and hoarding. The ones in red are not in the exam, but I will rush through them real quick. So in order to understand obsessive compulsive disorder, you need to understand two words. What is an obsession and what is a compulsion? Write this down. An obsession is when you cannot stop thinking about it. So you're sitting there thinking, germs, germs, germs. You can't stop thinking about it. You're obsessed. A compulsion is when you can't stop doing something. It's a behavior, like washing your hands or checking the plugs, checking the stove, checking the alarm 50 times a night. And I'm not exaggerating, literally 50 times a night. Or every time you enter the room, you tap your foot 4 times. 1, 2, 3, 4. That's a compulsion. When you combine obsessions and compulsions, you get obsessive compulsive disorder. So most common contamination of fears of germs, dirt, harming other people. Some people get obsessed with harming people they care about. Like you have this image of your head and killing your husband or your wife, and then you check yourself into the hospital because you can't stop thinking about it. Even though you would never do it, you obsess about that. Sexual urges, sexual thoughts, excessive religious or moral doubt, just thinking excessively about something specific. That's an obsession. The compulsions are on the right. Those are compulsions. These are obsessions. Okay. So let's look at a PET scan. In a normal brain, it looks like this, but in an obsessive brain, look at the frontal lobe. It's being overactive. When you are obsessive compulsive, your frontal lobe is going in overdrive, similar to anxiety. All right, write this down. What causes OCD, obsessive and compulsive type symptoms? Abnormalities in serotonin and GABA receptors. GABA is a neurotransmitter that chills you out. And you can actually buy GABA on Amazon for $10 a bottle. It's very mild, but you don't need a prescription. Um, and serotonin is involved in depression, but it's also involved in obsession. When you fall in love, when you start seeing somebody romantically, your serotonin levels drop. And that's why you get obsessed about that person. It's all about serotonin. All right, moving right along. Oxytocin is for pair bonding and love. When you cuddle, hug, when you fall in love and you imagine, I want to go do boring things with my girlfriend or with my boyfriend. I want to go and do laundry with them and clean the house with them. That's pair bonding. I want to make babies with them. That's oxytocin. Okay. Hoarding. You may know about hoarding. Hoarding is an obsessive compulsive disorder where people will not throw away stuff, including literal garbage, and they just let it build up in their house, and their house becomes dangerous, and it's really difficult to treat. I mean, there's no pill for that. It takes professionals and medication to help a hoarder. It's very difficult to treat. Okay, that's all I've got on that. If you go to YouTube and type in hoarders, you get entire seasons of a show where they try to help people who are hoarders. All right, not on the exam, but trichotillomania is an obsession with pulling your hair. I can relate because I bite my nails, so I can kind of, it's like, oh, that hair feels out of place. So they pull it. Sometimes they eat the hair. When they eat the hair, you might have to have surgery to get the hair removed from your intestines. Howie Mandel has trichotillomania, so instead of thinking about pulling his hair, he just shaved his head as a solution to not pulling his hair. Not on the exam, but excoriation is an obsession with picking your skin. And body dysmorphic disorder. People, this is not on the exam, but people who get obsessed with plastic surgery and they look in the mirror and what they see in the mirror does not match reality. One day in the 80s, Michael Jackson looked in the mirror and said, I don't want to look like that. I want to look like this. So again, maybe there was nothing wrong with him. I don't know. But here's another guy with body dysmorphic disorder. He paid a lot of money to look like a Ken doll. But then that wasn't good enough. So this is what he did. He came out as transgender. Anyway, so that's the same person. Here's a guy who paid $84,000 to become a genderless lizard. So yeah, that's an issue. How do you treat anxiety? With anti-anxiety medication, and with cognitive therapy, and with exercise. Xanax is a common anti-anxiety medication. GABA, I told you about that earlier. It's really mild, but it does work. Okay, answer this. People who habitually wash their hands numerous times before going to bed most likely have a what? All right, the answer is it's a behavior, so it's a compulsion. Carl has recurring unwanted thoughts. Recurring unwanted thoughts. The answer is, I know this is a weird question, but when you have recurring unwanted thoughts, that's an obsession. Persistent, repetitive thoughts that cannot be controlled are known as what? The answer is obsessions. A, that's compulsions or behaviors like hand washing. All right, do this question. The answer is C, GABA and serotonin. All right, write this down if you want. I mean, unless you're just totally, I hope you're not too familiar with it personally, but PTSD, post-traumatic stress disorder, is caused by trauma. And it could be violence, but it could be other things. It could be losing your job. I know this is weird to a teenager, but when you are like 40 years old and you get fired, that is traumatic. Trust me, it's traumatic because it messes with your world in a major way. Infidelity can be traumatic if you get cheated on. To you, maybe not, but when you've been married for 20 or 30 years, it can be very traumatic. Witnessing a murder, being assaulted, can be traumatic. The symptoms include flashbacks and nightmares. Wetting the bed can be a symptom too. Now, this down here is not on the test, but it's a popular movie, so I wanted to just mention it. Okay, moving right along. So, how do you treat PTSD? With cognitive behavioral therapy, but also with virtual therapy, exposure therapy. They'll create computer simulations of the worst day of your life and then play it for you. You play it like in VR, virtual reality, and then the therapist is there to help you habituate to the anxiety. Okay, write this down. So here's another classification: dissociative disorders. So think of the word associate. You associate yourself with a certain group. Now, let's say you don't like those people, so you disassociate yourself from those people. So dissociative disorders is, think of it as you are disassociating yourself from some sort of trauma. So let's say you experienced a trauma. You could respond to that trauma by forgetting that it happened. That's called dissociative amnesia, where you don't remember that it happened. You could say the trauma did not happen to me, but it happened to another personality of mine. Multiple personalities, we call that dissociative identity disorder. It's a way to deal with trauma. It's not very common. Going back to dissociative amnesia, you could go on a journey of some kind. Fugue, think of the word fugitive. Fugue. Dissociative amnesia with fugue is that when you forget who you are and you take off. and you wake up in a hospital not knowing your name or remembering any kind of trauma that you experienced. Or maybe you end up sweeping floors in a truck stop or something, and you don't remember who you are or what your name is. That's very rare. All right, so plenty of shows on dissociative identity disorder. I used to show this to my kids, but it is not appropriate to show in high school. Very good show on dissociative identity disorder. Dissociative amnesia is like repression. You don't remember the trauma. And this means that this isn't caused by brain damage, it's caused by trauma. It's psychological, not physical. So think of a little boy who witnesses his parents being murdered and he doesn't remember it. Repression. But we call it dissociative amnesia. Remember, to treat amnesia, you use retrieval cues, show them pictures, take them home, play them music. And then fugitive. I already explained this, but think going on a journey. Okay? This is rare, except on soap operas, then it's common. All right. All right, let's do a few questions. Read that. The answer is PTSD. All right, read that. The answer is, so Dan went on a journey, that's fugue. And he forgot who he is. That's dissociative amnesia. All right, this is a classification question. Which one of these correctly classifies the illness? The answer is D. PTSD is a trauma and stressor-related disorder. Okay? All right, that's enough for today. Thank you.